Previously, I have sent you a lecture on the development of the female sexual organ, which I sent you just a PowerPoint presentation. Today, I am preparing a lecture, voices recorded lecture for you people. Hope it will help you. The previous lecture was on the development of the female sexual organ, and today lecture is a brief review of the anatomy of the female external genitalia. Female genitalia. These anatomy and embryology you people have studied in detail in the first year, in the second year. This will be just a revision, and you people will know it better and memorize it will better than me, because your knowledge is fresh about this detailed anatomy. First is the ex- external female genitalia. As you all people know, the external female genitalia consist of mons pubis, labia majora, labia minora, vaginal vestibule, clitoris, and greater vestibular gland. This is a picture which I have taken from the atlas for the better understanding for you people. The first is the labia majora. This is labia majora. Labia majora, these are two fold of skin with underlying adipose tissue, and these lying on either side of the vaginal opening, and this consists of sebaceous gland and sweat glands. The second is the labia minora. Labia minora. The labia minora, these are two thin fold of skin that lies between the labia majora. They are very in size. Sometimes they protrude outside the labia majora. Interiorly, they join to form the clitoris, and posteriorly, they form a thin sheet of skin, fold of skin, which is called posterior foresheet. The next thing is the clitoris. The clitoris is an erectile structure measuring about 0.5 to 3.5 centimeter in length. The body of the clitoris is this is the body of the clitoris. This one, the body of the clitoris. It is the main part of the clitoris. The next thing is the vestibule. The vestibule is the cleft. This is the cleft which lies between the two labia minora. It contains opening of the urethra interiorly and the vaginal opening posteriorly, and the Bartholin gland which lies in the labia minora. The next thing is the labia, the Bartholin gland are bilateral and about the size of a pea. The next is the hymen. The hymen is a thin covering of mucous membrane across the enters into the vagina. It is usually perforated, which allow menstruation. The hymen is ruptured during intercourse, and any remaining tag are called carnunculi multiformis. These are external genital organ. The next is the internal genital organ, the internal reproductive organ. The internal reproductive organ consists of the vagina, uterus, cervix, fallopian tubes, and ovaries. The vagina. Vagina is a fibromuscular canal lined with stratified squamous epithelium that lead from the uterus to the vulva. Its length is about 9 centimeter posteriorly, and interiorly it is about 7 centimeter. It is also divided into four fornices. One is interior, one is posterior, and two lateral fornices. The one thing in the vagina is a common commensal organism which is called Dodeline bacillus. It is normal vaginal flora, and Dodeline bacillus it converts the glycogen in the vagina to the lactic acid and produce a pH of 4.5, and this pH prevent the growth of pathogenic organism in the vagina. In the vagina, the interiorly it is continuous with the base of the bladder, and posteriorly it continues or it is opening behind into the pouch of dog legs. The next thing is the uterus. Uterus shaped like an inverted pear, taper inferiorly to the cervix. Its length is about 7.5 centimeter. It is wide about 5 centimeter and thickness is 3 centimeter. The part of the uterus, one is body or corpus, second is cornea, one is fundus, what is isthmus. Look at the picture. The picture, this is the core, the uterus. The upper part of the uterus, this is called the body or corpus. The area of insertion of the fallopian tube, this portion, this is called the cornea, and this part above the corpus, this is called the fundus of the uterus, and the uterus constricted inferiorly, and this constricted area is called the isthmus, and from the isthmus onward the cervix begin. One thing is antiversion and anteflexion, in which the uterus is protruded towards the urinary bladder and flex position. Then it is called anteflex, antiversion. This is normal anatomical position. The second thing is when the uterus is backward, then it is called retroversion, retroplex. And when we see the uterus through the cut section, then the cavity of the uterus is like T shape. And the third thing is the layer of the uterus. The outer surface of the uterus, which is covered by serosa, it is called serosal layer. The middle point is this is the muscular layer, and this is called myometrium. And the inner portion, it is lined by gland and stroma. It is called the endometrium. These are three layers of the uterus. The next is the cervix. It is about 2.5 centimeter in length. The cerebral connective tissue, which is lying on the side of the cervix, is called perimetrium. And the later run about 1 centimeter relative to the supravaginal cervix. And this point is very important because when we are performing surgery, we are taking great care so that the ureter is not in danger. The other thing is the scamocolumnar junction, which is the lining. The upper part of the cervix is lined by the columnar epithelium, the lower part the squamous epithelium, and the junction of the two point is called the squamous columnar junction. This junction is very important because in cervical carcinoma, this junction is changed, and we are taking sample for screening and diagnostic purposes from this point, from the squamocolumnar junction. The next thing is the fallopian tubes. The fallopian tubes, it extend outward from the uterine cornu, outward from the uterine cornu, so into the ovary. Fallopian tube convey ovum from the ovary towards the uterus. Its length is approximately 10 centimeter, and it's described in four parts. The interstitial part is the part which lies inside the uterus. And after the interstitial part is the narrow constricted area which is called isthmus. After the isthmus is the long and distendable portion of the fallopian tube. It is called the ampulla. The other end of the uterus is called the infundibulum. And infundibulum is surrounded by finger-like projection, which is called the premial portion. And in this premial portion, this premial portion is important for collecting the ovum from the peritoneal cavity and help in the transport of the ovum through the fallopian tube to the uterus. Other thing is the ovary. The ovaries. The ovary size and shape depend on both the age and stage of the menstrual cycle. In adult, it is about 3 centimeter long, 1 centimeter, 1.5 centimeter wide, and 1 centimeter thick. And the ovary is the only abdominal organ which is not covered by the peritoneum. And the detailed anatomy and structure of the ovary, you people read it and study it in detail in the histology. How the follicle is formed, how the follicle is ruptured, how the Graafian follicle is formed, and how the corpus luteum is formed. These all things you people have studied in detail in the embryology and also in the anatomy. The other thing is the pelvic diaphragm, the genital diaphragm, and muscle of the perineum, the genital diaphragm, pelvic diaphragm. These just revise it from the anatomy. The next thing is blood supply of the pelvic organ. The arteries which supply the pelvic organ are mostly the ovarian artery, internal iliac artery, and the superior artery. The ovarian artery, it arises from the ovarian artery. It arises from the abdominal aorta. Arises from the abdominal aorta because the ovary develop in the abdomen and then migrate downward towards the pelvis. So it's taking its blood supply from the abdominal aorta and go downward and where in it enters the most with the other artery and supply the uterus also and also give branches to the fallopian tube. And the second thing is the internal iliac and the uterine artery. The vaginal artery, the vesical artery, the middle rectal artery, and the duodenal artery. These are all branches of the interior division of the internal iliac artery and which give main supply to the uterus, fallopian tube, and to the ovary. And the other thing is the superior rectal artery, which also in anastomose with the other arteries and supply the female genital organ. Mama. 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 This is a picture which is showing the blood supply, the venous drainage, and lymphatic system of the internal genital organ. The lymphatic supply and the lymphatic drainage. The second picture, which is also showing in detail the blood supply to the ovaries, fallopian tube, uterus, and the cervix and vagina. Showing the blood supply and the drainage. Mostly the venous drainage is mostly to the median vein and the internal iliac vein. And the lymphatic drainage, internal reproductive organ of the female in the female genital tract, the lymphatic drainage is very important because when patient is suffering from carcinoma, the metastasis occur to these lymphatics. So the lymphatic drainage of the different organ is very necessary to know. Next topic is structure problem of the pelvic organ, which is called Morainian anomalies, which is occur in 6% of the female population. 30% are associated with renal anomalies. The exact etiology of this is not known, but it affects 6% of the female. These are different structures which shows Mullerian duct anomalies in which the paramezonephrine duct is not properly developed. One is called the this is variant of the uterus didelphys in which there is double uterus but double cervixes and single vagina. This is called bicornuate uterus. In bicornuate uterus there is two cornua of the uterus but single cervix and single vagina. And the second thing is the unicornuate uterus. The unicornuate uterus and there is single horn of the uterus. This is uterus didelphys. There is double uterus, double cervixes and double vagina. There is subsequent uterus in which the cavity of the uterus is divided into two by partial septum. And there is septate uterus in which there is complete septum arising from the fundus to the cervix and the uterine cavity divided completely into two. Mm. And this second thing is Mullerian obstruction. And in this failure of the complete canalization of the Mullerian structure can lead to menstrual obstruction and the patient presented with impurpurate hymen causing hematocolpus. Hematocolpus is basically collection of the menstrual blood in the vagina and the female usually presented with the cyclical abdominal pain. And the hematocolpus treatment is simple. We are just giving cut on the hymen to open a pathway for drainage of the menstrual blood. This is a table which is showing classification of the Mullerian anomalies. Is class 1, 2, 3, 4, 5, 6, 7. In class 1, there is segmental agenesis. In class 2, the uterus presented in varieties of way. Sometimes having rudimentary horn, sometimes having communicating horn, sometimes having non-communicating horn. And the third class is uterus didelphys, in which there is double uterus, bicornuate uterus, which has two cones, and class 4 is complete or partial septation of the uterine cavity. And class 6 is there is just indentation of the uterine fundus. In class 4, the uterine cavity is T-shaped and it is mostly due to diethylstilbestrol drug exposure during intrauterine life. And this is this classification, which I have showed you in the table. One thing is agenesis. In this, Mullerian system does not develop, resulting in an absent or rudimentary uterus and upper vagina. This is called Mier-Rokitansky-Kaiser-Hesser syndrome. In this syndrome, the ovaries function normally, but the uterus is absent. The common presentation is with primary amenorrhea, and it is diagnosed by ultrasound. In ultrasound, the uterus is absent and the ovaries are present. In this patient, the ovaries are present, so there is normal external female genitalia, but internal genitalia are absent. Internal genitalia means uterus is absent, and the treatment is just giving psychological support to the patient. Other thing is vestigial structure. This thing you people have studied in detail in the first year. These are vestigial remnant of the mesonephric duct, which is called epiporon, paraporon, and duct of Gardner. You people take help from anatomy, Atlas Anatomy, and also by Kiny 10 teacher, 20th edition. Thank you.